everyone, we're Vaccinator of the Greater, and we'll be focusing on human papillomavirus, and we are Alexandra Kabebe, Aaliyah Goody, Omar Jacobo, Gina Lan, Anu Ho, and Andrea Villanueva. Vaccinator of the Greater's goal is to increase the number of HPV vaccines among low-income women ages 14 to 17 in the San Diego County. Vaccinator of the Greater's purpose is to recognize the importance and benefits of the human papillomavirus vaccine.
Our target population are females ages 14 to 17 from 20 high schools in the San Diego Unified District with an annual family income of $30,000 or less. Vaccinator of the Greater's objectives are to first increase the number of HPV vaccines in San Diego County among low-income women ages 14 to 17 by 150% in 3 years. Our second objective is to decrease the incidence of HPV in low-income women ages 14 to 17 in San Diego County by 10% in 3 years. Our third objective is to hold 60 interventions at 20 schools in San Diego Unified District in 3 years. And our fourth objective is to increase the awareness and convey how serious HPV is to low-income women ages 14 to 17 in San Diego County by 75%. We want our population to recognize the importance and benefits of this specific immunization. By providing them with the understanding and knowledge about HPV vaccines, the health belief model will help shape their attitudes and beliefs in a positive way.
Vaccinator of the Greater will be focusing on the health belief model. Perceived susceptibility of HPV are common sexually transmitted diseases among women ages 14 to 17. We will inform women ages 14 to 17 about the perceived severity of cervical cancer and it being the 11th most common cancer among women in California. There have been approximately 1,500 women in California diagnosed with cervical cancer and 400 deaths from the disease annually. Perceived benefits of HPV vaccines reduce the risk of cervical, vaginal, oral, and anal cancers among females, and HPV vaccine Gardasil 9 prevents genital warts in females.
Some of the perceived barriers include fright of HPV, vaccine side effects, language barriers, and cultural barriers. Some perceived threats of not receiving HPV vaccines include contracting cervical, vaginal, vulvar, and anal cancer among females. Our cue to action includes providing HPV education programs in San Diego, participating in health fairs around low-income communities, and advertisements in the Union Tribune about HPV vaccine data. Our overall preventive health behavior is to encourage females ages 14 to 17 in the low-income communities of the San Diego County to increase HPV vaccinations.
The main outcome we plan to measure is the rate of HPV vaccination and the overall awareness of HPV among our target population after the completion of our intervention program. We will be measuring our outcomes by conducting a face-to-face survey. Some of the questionnaires included in the face-to-face survey are: have you received the human papillomavirus vaccine? Do you know about the human papillomavirus vaccinations? And how serious do you think the human papillomavirus is?
As mentioned previously, we will be surveying the participants during their pre-test and post-test. Some of the questions include: have you received the human papillomavirus vaccine within the last year? This question is nominal because there are only 2 categorical answers, yes or no. Do you know about human papillomavirus vaccinations? This question is also nominal because there are only 2 categorical answers, yes or no. How serious do you think the human papillomavirus is? This question is described as ordinal because there are 5 categorical answers: very serious, serious, indifferent, not serious, and not at all serious.
Vaccinator of the Greater's project includes randomization of a control and comparison group. VOG will be comparing the rates of HPV vaccines during our pre-test and a post-test that will be held 1 year after the intervention. The interventions will continue for 3 consecutive years. We have 2 timelines, one focusing on the normal intervention and the second focusing on the enhanced intervention. Both interventions last for a total of 65 weeks. For the normal intervention, week 1 will focus on a pre-test where individuals will have a face-to-face survey with a member of VOG's team. During week 13, VOG will hold a normal intervention. For week 26, VOG will head back to the schools to distribute flyers about HPV in English to bring home to their families. Week 65, we will conclude with a post-test to see how many participants have received the HPV vaccine. For the enhanced intervention, we will focus on a pre-test where individuals will have a face-to-face survey with a member of VOG's team. During week 13, VOG will hold an enhanced intervention. For week 26, VOG will head back to the schools to distribute flyers about HPV in various languages, including English, Spanish, Vietnamese, and Chinese, to bring home to their families. The main difference between the normal and enhanced intervention is that in week 52, the enhanced intervention includes a second intervention. Week 65, we will conclude with a post-test to see how many participants have received the HPV vaccine.